all of these are conditions, correct, doctor?
Absolutely, and this is just a short list in terms of everything that can actually cause your pain. Starting with the first one, just back pain in general. Is it due to muscular issues, or is it a mechanical problem? Did you upset one of the small joints in your back? Then we can talk about cervical radiculopathy and lumbar radiculopathy. That word implies that there's dysfunction of the nerve. So the nerve isn't happy. Is it just inflammation that's causing some nerve pain, meaning pain going down your arm or down your leg? Or is there a herniated disc, pushing on that nerve? Other sources of pain in your back, degenerative disc disease. The name is a misnomer. Everybody will develop degenerative disc disease. It's not a disease. It's part of the normal aging process. However, there are times where the disc will have an abnormal anatomy that can be painful.
I think it's also important to then note the top risk factors, because if people are aware of these risk factors, possibly maybe they can prevent this from happening. Aging.
Absolutely.
Which obviously we cannot prevent, but maybe we can prepare better for that. Genetics, yes. That's a big one. Occupational hazards, sedentary lifestyle, and excess weight. That one we can work on, can't we?
Absolutely. Some of these you can modify, some you can't. Occupational hazards, the more physical your work, the more heavy loads, the more abnormal postures you're putting your spine in, the higher risk of you developing some back pain. On the opposite extreme, sedentary work is also a risk factor, prolonged sitting.
Sitting down a lot. There's a lot of people that are behind their desk, in front of the computer. They're not moving a lot. And we tend to hear doctors say, get up for a few minutes, walk around if you have 30 seconds, right?
That's key, and I tell my patients that all the time. If you have a chance, get up every 45 minutes, walk to the bathroom, go get some water, and reevaluating your workstation. You want to make sure if you're sitting behind a desk, your computer is eye level, you have a back support. You want to make sure that your spine is as close to possible as it could be in its natural alignment.